Hello guys. So C-reactive protein is basically a acute phase protein. It is having a structure that is annular structure, that is a ring shaped, and it is discoid also, disc like. It is basically found in the plasma during any inflammatory conditions. So now let us know about the structure of this protein. So basically it belongs to a family of the protein known as small pentraxins family, and it has 5 monomeric units in its structure. Thus it is a pentameric protein basically, and it has 224 amino acids in one molecule of this. It is synthesized mainly by the liver in our body. In the liver there are hepatocytes which synthesize this C-reactive protein. Another point which may I include here, that is it is often confused with C peptide or protein C, but it is not related with these two things. C peptide is related with insulin, and it is related protein C, it is related with the blood coagulation. So now let's talk about some of the history and the nomenclature of the C-reactive protein. Why this is called as C-reactive protein? So it was first discovered by the two scientists. They are Pillet and Francis in the year 1930. So it is a fact that it was first protein to be identified that is a pattern recognition receptor. It is the first pattern recognition receptor to be discovered. At first, it was thought that this C-reactive protein is a pathogenic secretion, but later on it was revealed that it is a native protein instead. So now, why this protein is called as C-reactive protein? So let us know about it. It was found in the serum of a patient which reacts with the somatic C carbohydrate antigen of pneumococcus, or that is also known as streptococcus pneumoniae. So that is why, as it reacts with the C carbohydrate antigen of the pneumococcus, thus it is known as C-reactive protein. This is how the nomenclature was given first. So as all we know that every protein has their genetic basis. So the C-reactive protein also has its gene that is known as CRP gene. It is located on the first chromosome in the human genome. So now let us know about the mechanism of action of this C-reactive protein. So first of all, there are some conditions in which these C-reactive proteins can be found. So inflammatory conditions basically, like viral, bacterial and fungal infections, then tissue injury, malignancy, that is cancer, and also necrosis. These are the conditions which basically stimulates the secretion of the interleukin 6 from these two places. They are the macrophages And the adipose tissue cells, they secrete interleukin 6 and other cytokines like interleukin 1, 8, TNF alpha, like them. So in the blood circulation, these interleukin 6 goes to the liver, where this interleukin 6 stimulates the hepatocytes to synthesize the C-reactive protein. So this is the C-reactive protein molecule, and these C-reactive proteins, they are released into the blood again, and from there they go to the site of the infection. Here these are the bacteria, pneumococcus like bacteria. So they go there, they basically bind with the phosphatidylcholine, basically it is lysophosphatidylcholine in the membrane of these bacteria, and through the process of opsonization they activate the complement system. This complement system attracts these macrophages, and they go and engulf the bacteria, that is the phagocytose them, and kills them. So this is how the C-reactive proteins acts in the process of infection and the immunity. So basically we can say that this C-reactive protein helps us to clear up the necrotic and apoptic materials from the body. So now what is the clinical significance of the CRP? At first you have to know that if there is any inflammation in the body, the CRP level rises within 2 hours of time, and its half time in our circulation is around 18 hours. So basically plasma CRP level is used for marker as it is extremely the plasma CRP level is used as marker for any inflammatory condition. At first there are several factors which can affect the CRP production in the liver. Now, one of the factors is liver malfunction or liver failure, and another cause might be, that is very important cause, that is interferon alpha, which interferes with the production of CRP by the liver. Interferon alpha is found in viral infections. So this is why CRP is a very important compound in our body to be assessed to differentiate between viral infections and bacterial infections. So here we can discuss that in bacterial infections the CRP level is much more higher than in the viral infections. So in viral infections it might be around 40 milligrams per liter, and in case of bacterial infections it might be around 40 to 200 milligram per liter. So we can see here that there is a huge difference in the bacterial infection. So this is used for differentiating between viral infections and bacterial infection. The normal value of CRP in a healthy person's serum is around 5 to 10 milligram per liter, and there are several factors which cause increase in the level of CRP. There are physiological causes and pathological causes also. So let us discuss about these. There are some physiological causes and there are some pathological causes also. So let us discuss about the physiological causes first. First is age. In elderly people the CRP level is increased. That means with age the CRP level in the plasma increases, and in case of late pregnancy also we can see elevated CRP level. So next is the pathological causes in which the CRP level is increased. So let us see about what are the pathological causes here. The main pathological causes, as we all know, that is the infection or inflammation. That is, infection may be due to any viral or fungal or bacterial, and there are certain other diseases in which there is another condition, I'm sorry, that is in case of burns, the level of CRP may just increase above the 200 milligram per liter also. This is another pathological condition. So there are some research studies, they suggest some effects of CRP. So basically higher CRP levels are associated with colon cancer. It is seen that then those persons who are having more CRP level in the plasma, that is the average CRP level, they are more prone to the colon cancer, and also they are more prone to the diabetes, hypertension, and various cardiovascular diseases. And it is seen in the research that they are also associated with coronary heart diseases when there is the CRP level is more than 2.4 milligram per liter average. There is double risk factor for coronary heart disease than in the 1 milligram per liter level. That means there is more higher level of risk factor in case of increased CRP level in average. And in another condition that is known as obstructive sleep apnea, in this condition the interleukin 6 is increased, thus the CRP level is also increased. So this is all about the C-reactive protein, and it is also known that it is also can be said that in case of rheumatoid arthritis it is also used as a diagnostic and prognostic measurement of CRP level. So this is also to be included, and this is all about the C-reactive protein here, and thank you for watching.